This, friends, is the story of a patient who went to the ENT and for 2 months took antibiotics without any success until he finally saw a dentist, and we found something that sadly happens a lot in medicine. Doctors specializing in otolaryngology literally check ears, nose, and throat. They're in charge of this whole system that's very close to the mouth. Many patients, for example, have ear pain, go to the ENT, and it turns out they have pain in the joint. It's very common, and we're constantly referring, meaning I send patients to the ENT, and the ENT sends them to me as a dentist. However, unfortunately, some ENTs still don't see the patient as a whole, as something complex, and they want to solve all the problems in their area without looking at the others. And this was the case with our patient. Our patient says he started having discomfort. For example, when he bent over, he felt like pressure up here, right? Like something just didn't feel right. Something was wrong. He had some allergies, and suddenly he had like a runny nose on one side. So he went to see the ENT. The ENT put a little camera in and said, "You have sinusitis, rhinosinusitis, so we have to give you antibiotics." There were no x-rays, no CT scans. It was just the image he saw with his little camera. So he prescribed a course of antibiotics for 7 days, and the patient felt better. However, after 2 months, or about a month and a half, he started again with the exact same discomfort, even a bit stronger. He went to see the ENT again, who said, "Gee, I think the antibiotic wasn't enough. We need to give you another, stronger antibiotic." So there goes the second round of antibiotics. Again, he just checked him with the camera, gave him his antibiotic. He felt better again for a while, but he relapsed again. By the third time, obviously, he didn't trust it. He went to see another ENT, and that ENT, who is very different, is the ENT we work with, immediately told him, "Look, it's only on one side. It's inflamed on this side not so much. You have to go see the dentist because it could be something that doesn't just come from the nose." And indeed, when he came to us, we did a dental CT scan, and in a matter of 5 minutes, no more, 5 minutes of reviewing the scan, we found what is odontogenic sinusitis. I'm going to explain to you what the difference is. There are two types of sinusitis, in this case we're discussing. One is rhinosinusitis, and the other is odontogenic sinusitis. What is the difference? Rhinosinusitis comes from bacteria, viruses from the respiratory tract that are stored in the maxillary sinuses and can get infected. And normally you see the maxillary sinus partially affected, completely affected, and it's totally independent of the teeth. This comes from the upper airway part, from the nasal passage, from some problem that arose in the airway. However, there is something called odontogenic sinusitis, and as its name indicates, it comes from the tooth. It originates from the tooth, odontogenic. What happens? If you have a tooth that is very close to the maxillary sinus, and this tooth gets a cavity, it gets infected, this infection crosses the Schneiderian membrane, which is the one that lines the maxillary sinus, and infects the sinus. And it has symptoms similar to rhinosinusitis, but the difference is that this one comes from the tooth. Now, here's the key, and this is what you have to pay very close attention to. You can give antibiotics for both, okay? Antibiotics. If you give antibiotics for this one, it'll work very well. Why? Because the infection is in the maxillary sinus, and they usually clear up with antibiotic therapy. You can give antibiotics for this one too, no problem, and it'll work very well, but there's a problem here, something that's being overlooked. What was the original infection? On this side, the original infection was a virus or bacteria that entered the maxillary sinus, but your own body will take care of clearing this infection with your immune system plus the antibiotics. However, here your defenses work the same, your immune system's fine, the antibiotics will work well, but the source wasn't the mucosa, it was the tooth. Therefore, if you don't treat the tooth, this infection will start again. This infection will resurface. Except there's a very interesting point here. In this case, the patient was already given 2 antibiotics, okay? Which went in and more or less cleared things out here, but the tooth remained infected. Therefore, these bacteria here may have already developed some resistance to the antibiotics that were used. Why? Because these are antibiotics that, although they wiped out most of the bacteria, left some that were resistant. And those that were resistant are the ones that grow back. You give them another round of a different antibiotic, you kill most of them, but those few that stayed alive because they're inside the tooth, they grow back again. But those bacteria might already have some resistance to that second antibiotic plus the first one. Therefore, a third antibiotic would have to be different, and we have to act on the tooth, okay? Because it's no use to keep giving this patient antibiotics, because where's the problem? The problem isn't in the maxillary sinus, where the antibiotic somehow reaches through all the veins and capillaries surrounding the maxillary sinus. The problem is in the tooth, and in the tooth, these veins and arteries usually don't reach. Why? because it's already necrotic, meaning there's no longer direct blood flow to the tooth. And that's why, friends, not just in odogenic sinusitis, but in any dental infection, antibiotics alone won't clear the infection. They'll help reduce the bacterial load to make the surgical intervention safer. However, if you think that with just antibiotics we can treat an infected molar, we're very wrong and we're going to have problems. In fact, it's one of the most common mistakes in dentistry, giving antibiotics for an infected molar without doing any treatment. So if the tooth is restorable, we can do a root canal to try to save this tooth and keep it in the body. However, there are many teeth that, due to decay or destruction, are no longer restorable and we have to remove them. So the treatment is either a root canal, as I said, or an extraction. And of course, if it's a root canal, it has to be reconstructed afterwards. If it's an extraction, you have to place an implant or something to replace this missing tooth. And in this way, we're treating what is odontogenic sinusitis. The treatment, as I told you, is tooth extraction or a root canal, and possibly antibiotic control as well. That has to be decided by your dentist. Whereas in rhinosinusitis, well, obviously the treatment is different, right? We'll have to see if antibiotics alone are enough or if the ENT has to intervene inside the maxillary sinus, but that's the ENT's decision. It's very important, as I say, that your ENT also has imaging. Why? Because without imaging, they're just guessing. I know clinical exams are very important, right? And if they look with the scope and see it's inflamed and infected, that's fine, but an image explains the situation much better. And what I'm about to say next might set off some alarms for some doctors, and unfortunately, that's just how it has to be. I'm going to give you my point of view. This is my perspective. Everyone can debate their own. If a patient has sinusitis symptoms, especially on just one side, we automatically have to think a bit beyond whether it's just rhinosinusitis. As a dentist, I suggest to ENTs that they perform a dental CT scan. What for? To rule out a dental problem. Why? Because if you have a patient with odontogenic sinusitis and you're only treating it with antibiotics, we're wasting very important shots we have to eliminate this infection. And besides, every time we take an antibiotic, we're also affecting the gut microbiota, the patient's oral microbiota, and the whole balance we have in the body. So antibiotics must be used with great discretion. And if we can use an image to rule out that it's coming from the mouth, we could treat the patient with more confidence and know exactly what's wrong. Imagine that they have 1 or 2 infected molars. Not necessarily odontogenic sinusitis, but they have 2 infected molars, and we're giving the patient an antibiotic for sinusitis, and on top of that, those 2 infected molars will already have bacterial resistance to that antibiotic. Why? Because since the molar is infected, even without odontogenic sinusitis, since it's infected, some antibiotic will reach it and will create the same bacterial resistance effect, but in each infected molar. So logically, it's worth it for ENTs to communicate more with dentists, for us to build better relationships, and of course, for referrals to happen more often. Why? Because this case could have been solved very easily if the patient had come to the dentist first. We would have done an extraction or a root canal and saved 2 extra rounds of antibiotics, plus 2 or 3 months of patient suffering, and not being able to solve a problem that was relatively simple to detect with the dental CT scan. I hope this video helps you. My intention isn't to create controversy with ENTs, but on the contrary, to help each other, to cooperate. There are many things that, for example, come from the ears instead of the joint too, and the dentist is being stubborn about the joint when it could be an ear infection. So we have to be in constant communication. For example, in my clinic, we check the airway a lot on CT scans. Why? Because often the patient's dry mouth or snoring comes from a nasal problem and not a mouth problem. Bleeding gums, these are things we have to look at together. That's why I say the best thing would be for us to always work in symbiosis, and it would be a better life for everyone. If you like this video, share it with that person you heard has sinusitis and doesn't know how to treat it or what to do. The dentist can help you quite a bit, and remember to subscribe to the channel. It's very important to subscribe and hit the bell so you get a notification when we upload a new video. See you in the next one, and take care.